South Africa is out of the fourth wave and level 1 regulations have been adjusted. The isolation period for symptomatic positive cases has been reduced to 7 days. And if you're positive but asymptomatic, you don't need to isolate at all. Rotational learning has also been scrapped, and so has social distancing in classrooms. Let's unpack all of this with Professor Koleka Mlisana, co-chairperson of the Ministerial Advisory Committee. Prof, thanks for your time. Appreciate it. So many South Africans are surprised by this decision for people who are asymptomatic but positive not having to isolate.
Good evening, Shahan. Thank you for inviting me, and good evening to all the viewers. Well, I guess the question is, we all have been waiting to get this announcement as to what's happening to isolation and what's happening to quarantining. So it really was good for us to see government coming out with this. Now, the question of asymptomatic, individuals is that I think what we all just need to remember, Shahan, is that really currently what is happening in the country is that the people who get tested are those that are symptomatic. And in fact, even the ones that are symptomatic, it actually is a very small percentage of people who are infected. And we have seen that we probably are only testing, just about 10% of people who are really infected when we look at the number of those that have had exposure and may not necessarily have come in for testing. That's number one. Then the second bit is that we do not test, asymptomatic individuals in the first place. These would only be tested when we do contact tracing. And we do know that really when we're looking at contact tracing, there's been hardly, we haven't really managed to institute proper and, effective contact tracing. So really the issue of people who are asymptomatic, in most, more than 90% of the cases, they will not be tested anyway. And so the question then becomes, what then is the point? Because we're missing out more than 90% of those, and what then becomes the point of looking at isolating those individuals? Fair enough, we do know that, asymptomatic, infected individuals do actually transmit the virus, but we really have to look at what are the chances of this transmission and what is the significance of that against the more than 90% that we're missing out anyway. And remember now, we are sitting 2 years down the line in the pandemic, and we are really looking at what are some of the measures we need to take to live with the virus, rather than trying to contain, infection. Because now we know, even, for those that have been previously infected, those that have been vaccinated, we are not going to be able to do away completely with transmission. So it's a matter of then what do we live with, getting into, mitigating, season.
Okay, absolutely get the fact that, people who are asymptomatic don't even test for COVID because they don't have the science to tell them, I need to go and test. But by chance, when somebody's probably going for a test because they're traveling or for work reasons, if they are found to be positive, and if you say that they are still infectious, why then shouldn't they isolate? Because it's still protecting others who these people will be in contact with.
I guess there's always going to be a way of how do we then strike the balance, because, looking at individualistic medicine versus public health. Because remember, when then such announcements are made, we're looking at public health measures. Now, the question is, when somebody gets incidentally tested and they turn out to be positive, firstly, we don't know when they were exposed and how long they've been positive for. And we do know that, the people are really highly infectious at the early onset of infection. And so we're never going to be able to pick up someone who's asymptomatic, how long they have been infected. And so really, like I'm saying, it then becomes a matter of, do you then make a public policy on the few individuals you are likely to pick up? That's the dilemma that we're facing.
I got you. There was no clarity in the statement regarding the quarantining process, but you say that we've made a decision on this. Give me clarity on that, because I know if we're scrapping this whole thing for people who are asymptomatic and not isolating, is that then the implication for quarantining? You don't have to do that either if you've come in contact with someone who is symptomatic.
Well, I mean, if I look back, to what we did as the Ministerial Advisory Committee on COVID-19, we did submit, 2 advisories to the Minister of Health, and one was looking at quarantine, and we're very clear with quarantining that actually for people who have actually had exposure to somebody who's positive and they have got no symptoms, there's no need for them to quarantine. We had said that, up front. And the same thing actually we did say about contact tracing, because we really have not managed to do contact tracing, and especially with so much community transmission that we have had, it really just becomes a futile exercise. So from where we sit as the MEC, we had already said we really should be doing away with quarantine in any way.
But has that change been made? Because government issued that statement and then it retracted it, and I don't see anything about that in this statement from last night. Do you know?
Well, no, I don't know. So I mean, I guess that's where the issue always comes. We submit an advisory based on the data that we have, and then we leave it to government. And sometimes you find that how then that gets communicated, it might be different from what we had submitted. But I mean, we do know what we had submitted, and it was very clear what we had proposed.
All right. Lastly, just in terms of that 1 meter rule being scrapped in classrooms, of course, we know that in South Africa, we have classrooms that are really overcrowded. Is that not a concern at all for you? And if so, tell me why not.
So insofar as, the social distancing in schools, and as you correctly say, we had to look at, the advantages versus disadvantages. And I think every South African now is fully aware of the negative impact, that the rotation of schooling has had in the country. So when we were reviewing this, we realized that actually we could have said, let's look at, where schools are able to do social distancing and still at the same time have all students or all scholars coming into the school, we would say that needs to carry on. But we're aware of the fact that it may not be practical for most schools in South Africa. Now we had to look at social distancing versus the other public health and, and social measures that are being implemented. And so we basically are saying for schools, what becomes important, if there's proper ventilation, opening of windows, there's masking when children are in class, then in situations where you are not able to actually adhere to the 1 meter distance, because of the negative impact of rotation, rather keep this, the students all in the class, but just make sure that the other measures are adhered to. So it's a matter of, trying to see what's the best that you can take given the circumstances and the negative impact we have seen over the last 2 years.
All right. Thank you so much for your time. Professor Koleka Mlisana, co-chairperson of the Ministerial Advisory Committee on COVID-19.